Victoria. Hey, Dr. Roll, how you doing?
I'm good. How are you?
Good to see you.
Good to see you too. Thank you so much for
Are
having
you
me.
kidding me? I'm like very excited to do this. We need to do this.
We do need to
Do you want?
do.
We
You
do
got
need to do this. We are
that.
doing this. Beautiful nails. Can you please introduce yourself to these people? Share your genius with them.
Oh my goodness. Thank you, Chris. Thanks so much for having me. People, my name is Charlotte Roll. I'm an adult infectious disease physician, and I'm also the research director at the Orlando Immunology Center. And I am an avid lover of PrEP. Okay, so super excited to be here with Chris and all of you tonight.
Amen. I know we got a window because you're on a schedule. Uh, so we're gonna do this Q&A, and let me start at the top. Who should consider taking PrEP?
Oh my God, Chris, everyone, Chris, what kind? That's an easy question. And I love what you said. You have been posting some really good info recently. I'm going to quote you on one of
Right.
the last part of the paragraph. You know, if you have genitals and you're rubbing those genitals, and anyone else who has genitals, when you have genitals rubbing, those two people should consider PrEP, right? I mean, CDC says that we should be telling all sexually active adolescents and adults about PrEP. And did you know, Chris, that's actually a recent update to their guidelines? They never used to say that before. But now providers should be telling everyone about PrEP who's having sex. Doesn't matter
What do
with
you
who,
think?
how many, doesn't matter. Everyone should hear about PrEP. I know it's an option for them.
What do you think changed that for the CDC?
Well, you know, Chris, we've been seeing a steady number of new infections for the last few years, right? I see that you've posted some information about that too, you know, and actually during the COVID pandemic, up, right?
Hmm.
And we were doing pretty good in terms of having a declining rate of incident HIV or new HIV infections. And then we saw another uptick, and it's been steady ever since. And so clearly, what we are currently doing is not working. So more proactive measures are required.
Many things are not working in more ways than one. What are the most common misconceptions and myths about PrEP that you've encountered, especially among heterosexual men?
Oh my goodness. Well, number one, Chris, is that if you are on PrEP, obviously you must have HIV, right? Like that's the most common misconception. Is such a big driver of PrEP stigma. And I think, like you said, among the heterosexual community, like that is one that really stops people in their tracks. But PrEP is for those who are HIV negative. And as a matter of fact, the testing and monitoring algorithm to prove that you have continued to stay HIV negative so that you can continue to get PrEP from your provider is really strict. And all of us follow that to a T, you know? And so that's the most common one that I hear. And I want people to know that use of PrEP, a single drug that is used to treat HIV, sure, but drug by itself, not in combination with anything else, it's not adequate treatment for HIV, okay? And so you see someone that's on one of the three drugs that we have for PrEP out there, and they're on it by themselves and they say it's for PrEP, you should probably believe them, because none of us who treat HIV would ever give any of those drugs, Chris, by themselves for
Hmm.
treatment. It would just not be good medicine.
And how would you address concerns or hesitations for people who want to start the PrEP?
You know, I think it's really important to take time to understand what those concerns are, right? I think that, you know, in medicine we only have a certain amount of time to see a patient. We're trying to manage that the best we can. But when I personally encounter someone who seems PrEP interested but PrEP cautious, you have to take the extra time to sit down and really try to figure out why, because that, you know, answer may not be apparent from surface level interactions. You know, you sort of really sometimes have to understand someone's background, someone's culture, someone's religious beliefs, someone's family dynamics, someone's relationship dynamics. Sometimes you got to dig into all those little facets, Chris, to really understand like why someone may be hesitant about PrEP. And I think a lot of us just naturally think it's the side effects, but for a lot of people that's not really it, Chris.
Dr. Rowe, I don't know if you see this incredible question in here, and if you want to speak to it. Uh, I had a doctor tell me that because one doesn't have an active sex life, you shouldn't put the chemicals in their body. My therapist said I should do more research on PrEP and Doxy. Do you have any thoughts to that?
Oh, that sounds like a provider who should have been on this IG live, Chris. That sounds doctor or a nurse practitioner or a PA that needs some extra education. They should have been on this IG tonight, okay? But I think like that's like advice that like makes me want to scream, you know? It's like, listen, it's kind of cool. The CDC has done a lot of new updates to the PrEP guidelines, right? And one of the things that they did, Chris, there used to be all these complicated algorithms about who actually met the criteria to get prescribed PrEP. Do you know that that algorithm still exists, but there's like a little arrow at each box that says prescribe if requested.
Hmm.
The CDC prescribe it if it is requested. Do not ask additional questions. Don't make someone prove that they need PrEP. They don't have to meet any of these specific criteria. If this person is coming to you expressing any kind of interest in PrEP, guess what? You need to write the prescription. That is the new guidance from the CDC on PrEP prescribing. And I think a lot of providers just don't know that, Chris.
Yeah, beautiful. And how are the steps to getting PrEP? They seem
Ah.
obvious, but maybe we should say them.
Maybe they're not that obvious, actually. So, you know, I think it is, it's actually a little bit different and maybe a little bit challenging depending on someone's insurance status, right? And how
Well said.
familiar someone is with accessing the healthcare system. So for those of you guys who are used to going to the doctor, you go for your annual exam every year, kudos to you, you know, but it's as simple as going to that same person and saying, you know what, I'm interested in PrEP. Can you tell me a little bit more? You know, and if you're not the right person, send me to someone who is. And I'll tell you, Chris, you know, I always tell patients this: if you're sitting in front of someone that you're not comfortable, and I'm talking about medical professional, if you're sitting in front of someone that you are not comfortable with disclosing, you know, details about your life, particularly your sexual health, for fear of anything, judgment, discrimination, that is not the right doctor for you. You need to move on and find someone else, right? And so I think that's the biggest barrier to PrEP for a lot of people, is that they don't feel comfortable talking about it with whoever that provider is that they have a routine relationship with. It's time for you to switch to a new provider,
Facts.
right? That's
100%.
one. So, you know, most of the time someone does have to see a provider to get PrEP. PrEP is available for people who are un or underinsured. There are several pathways to getting PrEP, right? There's Ready Set PrEP, which is the federal initiative that provides the 2 oral PrEP options free of charge, okay? Regardless of income, it's amazing. And then we have the companies that make PrEP. They all have their different patient assistance programs that can also provide PrEP to those who are un or underinsured. Now then, Chris, the issue for those who are under or uninsured becomes the issue of how do they pay for the doctor's visits? And how do they pay for the labs that are required to monitor how someone's doing on PrEP? There are PrEP assistance programs, depending on the state that you live in, that does provide some coverage for
Cool.
some of those elements of PrEP care. And so people just have to be informed. People just have to be curious enough to do a little bit of research. But there is a path to PrEP, I think, for everyone, regardless of what their situation is.
I had someone reach out to me in a DM and ask me a couple questions for you. And one of those was there seems to still be access to PrEP in rural areas. What would you say to that?
Or lack of access to PrEP,
Yeah,
or there is access.
lack,
Yeah.
lack, lack of access.
And you know, Chris, it is really something that our field has started paying attention to, trying to come up with solutions. And so one of the big initiatives in our field is teleprep, and it
Mm,
is provide folks who live in rural areas access to PrEP, right? Coming up with ways to have people do home testing and maybe send their kits somewhere, and then having tele-PrEP visits and just sending the prescription to a pharmacy that is convenient for them. The other thing that we have to do, Chris, to actually address that sort of geographical disparity in PrEP access is to get more providers comfortable with prescribing PrEP, right? Because even in those rural areas, or sometimes we call them PrEP deserts, there are
mm.
providers, Chris. They are just not familiar with PrEP. And so the healthcare system has a lot of work to do, but teleprep and getting more providers prescribing, I think are two of the key things that we can do to really push out PrEP to some of those areas where it may be a little bit tough right now.
I know we're on a short window. We've got 3 minutes left. I'm just going to encourage everyone for more of this genius on the regular. Follow Dr. Roll. Also, stay with Dr. Roll for the evening because she's going to be chatting with Joe Kraus next at 8:45. It's going to be amazing. One more question that was sent in my DMs that I think is real. What advice would you give to someone who is afraid of the prejudice that comes with this, or something they wrote was the religious bigotry? Like, what would be your advice to that person?
You know, Chris, I think that's really a great question. I think that is um, I think that there are certain communities and populations that are actually more like disproportionately impacted by what you just mentioned, sort of that stigma around PrEP prescription. And again, I think it comes back to the idea that I want to encourage people to look at PrEP as something that they have done to prioritize their own health, right? It's actually, PrEP is self-care. Like self-care is like so
Mm.
like, oh, great. You got to start thinking PrEP as self-care. Everyone's proud of self-care. Like that is not a topic that makes anyone ashamed to like announce that they're doing that, right? That's how we have to think about PrEP, Chris. It is a form of self-care. It is a form of putting your sexual health back in your own control, and it just is a form of prioritizing yourself. And I think that we have to change the way people think about this in order.
Beautiful. Yeah. Uh, there's a lot more genius to be shared. We're on a short window. If you want to keep having this conversation, y'all, go over to @Joe Kraus. They're going to continue this conversation. Follow Dr. Roll. The next conversation, I believe, is focused on the role of HIV PrEP in women's sexual health. Yes, women are involved in this thing too. Keep following the conversation. And Dr. Roll, any last words?
Oh my God. Okay, everyone, if you're interested in PrEP, find a provider who knows about it or who can at least point you in the direction. Okay. And if that provider cannot, you need to change providers. Like that is really my just genuine advice to you. Find someone who does know about it or who can at least point you in the right direction. Start with your primary care person, whoever that is, right? Whether it be a doc, NP, PA, it doesn't matter. They should be able to at least kind of, point you in the right direction and give you some good advice.
Y'all, this conversation is not going anywhere. It's going to live on my Instagram feed, and it's also going to be on the Vindico Medical Education Instagram and YouTube pages, so you can keep coming back for this. And have a beautiful, beautiful evening, Dr. Roll.